Hello, how are you today? I hope all of you to be fine. I am Dr. Abdalla Rifat, the pediatric specialist, and our lecture for today it will be about the DCH, which I have passed Alhamdulillah, and also I have passed the PLAB. Okay, let's start our lecture for today, which is called DCH from scratch, which means that we will say every small detail about the DCH and we will say everything from the beginning or from the start. If you don't have any information about the DCH, this lecture will be very beneficial for you. Okay, let's start. At first, what is the DCH? What is the DCH abbreviation denote for? It's for a diploma in child health. As all of you know that the Royal College in each branch of medicine have a membership certificate. Like as in surgery there is MRCS, in internal medicine there is MRCP, in pediatrics there is MRCPCH. The Royal College of Pediatrics have two certificates, the membership and the diploma of child health. Okay, at first, am I audible to all of you? Are you hearing me good, doctors? Doctors, are you hearing me good?
Yes, doctor. Yes.
Okay, okay. What is the advantage or what you make to go for the DCH? Okay, there is really a lot of advantage. The first one that only what you need it's your graduation certificate, your primary medical qualification. By your graduation certificate, you can apply for this exam. The another advantage is you don't need any specific language test, as like any another exam, like for PLAB, in example, you should take IELTS or OET with a specific score like 7 overall, but here there is no any need for any language test. As I said, only your graduation certificate. Okay. Also, you will be a pediatric specialist only in 1 year, and that's due to that the DCH is consist only of two parts, the foundation of practice and the DCH clinical. That are the two parts of the DCH. And I want to tell you that these two parts you can finish in 1 year. So after 1 year, you can be a pediatric specialist. Also, if you are going through the MRCBCH and you are like have a long waiting list for the MRCBCH clinical exam, as all of you know that the MRCBCH clinical exam has a long waiting list. I know that a lot of candidates go for the DCH clinical exam to get a certificate to be specialist until they have a seat in this long waiting list. Also, I want to tell you that you are not losing any money. If your target is to MRCBCH, the FOP, which is the first part of the DCH, it's already apart from the MRCBCH. So you can go for the DCH, and after this, if you want to continue to the MRCBCH, you can do this. As the part of the DCH, it's already one of the parts of the MRCBCH. Okay. As I said that the DCH parts are consist of two parts, the foundation of practice, and it is a multiple choice question exam. It's held 3 times per year, on February, June, and October. It's taken on computer but on a test center, not online. Yes, there is some countries you can take the FOB examination online, but in Egypt, it's in test center. You get an email before your exam, like by 1 month, have the address of the test center, and you go there and you answer this multiple choice question exam on a computer or on a PC in this test center. But there is some countries have an online. You can do it in your home, but not in Egypt. Also, there is a new update for the FOP examination. Now the FOP examination or the foundation in practice, it's become 100 best of 5 question. What is the best of 5? It's like you will have a case and you have 5 answers or 5 options, and you should choose the best one of them. That's called the best of 5. and each question is for 1 mark. And this 100 question, you should solve it in 120 minutes, which mean 2 hours. That is the new update. Before, they will have like MSQ questions and best of five and something called matching question. But now they make all questions only best of five. Okay. What is the fees for the FOB? For the overseas doctor, it's 455 sterling pound. Okay. The second part is the DCH clinical exam, and we have a preparation course for the clinical exam. Okay. What is the DCH clinical exam? It is an online exam by only your laptop at home. It's not, you are not going to any test center. It's only at your home by your laptop. And yeah, it's an online, but it is face to face. How come it's face to face? We will talking to a role player who is acting to be a patient, and you will discuss with the examiner. So you will open your camera, you will talk to the role player like you are taking history from him, and after this you will discuss with the examiner. He will ask you how you will manage this case, what is the investigation, and he will ask you. So it's, yeah, online exam, but it's face to face. He will see you and he will see your emotions, how you communicate with the patient, all of this. The DSH clinical exam, it consists of 8 stations, and each station is for 9 minutes, and it's categorized as the following: two history stations, two communication stations, one data interpretation station, one development, one clinical examination, and one safe prescription. Okay, let's discuss in detail each station of this. At first, that is the diagram for the station. Like you will begin with a communication, then another station is a communication. That is like what the exam circuit for the DCH. Okay, and between each station there is 2 to 3 minutes. It's called the preparation time or the golden time. Like before you enter the first communication, he will give you 2 to 3 minutes to read the scenario. Like what? You are talking to mother who her child has been diagnosed with bronchial asthma. Answer her questions. You have 2 to 3 minutes to prepare yourself to know what you are going to do in this station. So that is the 8 stations of the DCH, and between every station there is 2 to 3 minutes. Am I clear up till now, doctors? Is
Yes, doctor.
is there any questions?
No, it's clear.
Okay. And here I want to give you an advice. When you see this circuit, you can say, "Oh my God, it's a long exam. It's 8 stations, and every station is 9 minutes, and between each station there is 2 to 3 minutes. It's very tough and very long." But really, I want to tell you that according to my personal experiment, after you finish this exam, you will say, "What? Did I finish really? I felt like it's only 20 or 30 minutes have been passed." You will not feel any time during the station or the exam. Okay. The DCH clinical exam, it's held 2 times per day, morning and afternoon sessions. It's held 2 times per year, on May and November. And in every month, it's 6 days. Like in the next date for the DCH, it will be in May 2024. The first date will be 14, and the last date will be on 22. There is something called how you will can apply. There is times to apply for the exam. It will be from the 5th of February to 29th of February. That's called the application window. You don't have to pay for the exam at this window time. No. You just apply that I will go for the exam. I will apply for the exam. And after this, when you are accepted, They will give you all the details and how to pay. And another time it's in November, and it's also 6 days per month. And the application window, it will be from the 5th of August to the 3rd of August. Okay. What is the fees for the DCH clinical exam? In 2024, it's become 599 sterling pound. The last year it was 575. Okay. Here there is only an important point I want to say. As I said that the DCH exam, it consists of two parts, the FOB, which is the foundation of practice, and the DCH clinical exam. There is no any order to go for it, like I must go for the FOB, then for the DCH clinical exam. No. You can go for the DCH clinical exam at first, then the FOB. But my advice to you, take at first the foundation of practice, as all knowledge and all information of the FOB, you will need it in the DCH clinical exam. Really, it will be difficult for any candidate to go the DCH clinical exam without FOB. So my advice, no. Go for the FOB at first, then go for the DCH clinical exam. Okay. There is 7 year registration period. Okay. What is the meaning of 7 year registration period? You have 7 years to finish the DCH certificate. Like if you enter the FOB, you have 7 years if you want to wait to go for the DCH clinical exam. But my advice to you, you can finish all of it in 1 year. Why to waste your time? But if you want, like if you have any circumstances, familiar issue or anything, yeah, there is 7 years registration period. Okay. What is the marking scheme for the DCH clinical exam? You should get 160 from 192 to pass. That is the pass mark, 160. And each station from the 8 stations of the DCH clinical exam, it's divided into part A and part B. And each part, it's composed from 12 marks. Doctors, you are seeing my screen, right?
Yes, doctor.
Okay. That is the criteria of the marks. The 12 marks, it means the clear pass, that you do all what's needed. 10, you do the essential. It's mean pass. You do the essential according to criteria of the clear pass. Bare fail, لا قدر الله, you do some inappropriate number of minor errors. Clear fail, it's for you have a very poor performance. 0 is which unacceptable, you do unprofessional or dangerous behavior. Okay, that is the criteria mark for every station. And as I said, every station of the 8 stations of the DCH clinical exam is consist of two parts, part A and part B. And every part is from 12 mark. And that is the reason that the exam is from 192. If you multiply 8, multiply 12, you will have 192. As the station is divided into two 12s, part A and part B. But the bus is from 160. Okay, let's begin with the history station. What is the history station? It's a focused history. What is focused history? I want to know to tell you that there is a big difference between focused history and full history. In MRCBCH, it's a full history. Like you have 14 minutes, you ask every part of the history in details. But in DCH, it's focused. What's mean of focused? There is a very good example. Even they say it in their books of the DCH. Imagine that you are standing in an emergency department and you are taking a history from a patient. You don't have a time or welfare to have a time to ask every question. Your question must be targeted, must be focused. Every question you want to prove a diagnosis or to exclude a differential diagnosis, to search for a complication. So that's the meaning of focused history. Every question it's for a target. On the other side, the full history, which in the MRC-BCH, no. There is a 14 minutes, there's a lot of times. You ask for every tiny details, every many small details in the present history, the past history, but in this age it's focused. And really, the focused history, it's more difficult than the full history, as you should be very concentrated about your question, that there is a target for your question. And also, the time for the history, yeah, it's 9 minutes, but it's divided into 6 minutes for taking the history, and 3 minutes it will be a discussion with the examiner. Okay, that is the difference between the focused history and the full history. Is it clear, or anyone have question in this?
Clear.
Okay. In history, it consists of present history, past history, birth history, allergy history, family, and social. And the allergy history here is important, as it's supposed after you finished taking history from the patient or the role player in the exam, you will prescribe for him a medicine. So you should know that if you have any allergy to any medicine or anything, as you if you didn't ask about this and like you prescribe for him like augmentin, and he have allergy for amoxicillin, here you make a major mistake. So the allergy history is important. So the history is consists of present history, past history, birth history, allergy history, and family and social. Okay, I want to say a rule in the exam. In any time you are talking to a role player, and the role player which is imitating to be a patient, he is acting that he is a patient. You should not use any medical term, and that's logic. Even in our daily practice, the patient or the role player is not a doctor. He cannot understand the medical terms. I will give you an example. If you want like to ask if there is any vomiting, this is a medical term. It's a jargon. You will ask if there is any throwing up. You will use non-medical term to ask. So in any time in the exam you are talking to a role player, you should not use any medical term. Okay. As I said that it's a 9 minutes, it's divided into 6 minutes. You are taking history at this time, and 3 minutes, it will be a discussion with the examiner. The examiner will ask you, what's your diagnosis? What's your differential diagnosis? How you will manage this case? What investigation you should do? And I won't tell you that the DCH, the Diploma of Child Health, all of it, it's built on these three items that you should know: the differential diagnosis, the investigation, and the management. They are testing you for about these three parts in different station: in history, in communication, in data interpretation. All of them, they are testing you that you know the differential diagnosis, that you are know how you will manage, what investigation you should do. Okay, okay. That is the history mark criteria. As I said, there is clear pass, there is pass, there is pair fail, لا قدر الله, clear fail, and acceptable. Okay, clear pass, like you have a good communication, you do a full greeting to the role player, you ask all the questions, you in the answers you say all the differential diagnosis, you give the accurate information about everything. Okay, the pass, your performance was good but you were not fully fluent. You ask about the essential issues or essential information you should gather or collect in the history. And in the discussion, you say the most important differential diagnosis and you suggest the best management. Therefore, لا قدر الله, you was hesitant, you wasn't, don't have self-confidence or not fluent, you miss asking about very important information you should gather. You didn't say how you will manage this child correctly, and you miss a lot of differential diagnosis. Okay, communication station. As I said, there is two history stations in the DCH clinical exam. Also, there is two communication station. That means that the history and the communication, it's half of the exam. It's four station of eight, two history and two communication. So the history and the communication, it's very important. It's the main bulk in the exam. You should concentrate during studying in studying history and communication. Okay, what is the communication? You will talk to the role player only. There is no examiner in this station. The whole 9 minutes, it will be with a role player. And the scenarios of the communication, as it's written, it's maybe an information giving. What's information giving? Like a mother come to you and her child have been diagnosed with bronchial asthma and she don't know what's bronchial asthma. You will explain to her what's bronchial asthma. Okay. Maybe also a consent scenario. Like there is a child who is febrile convulsions and we suspect like meningitis or encephalitis, and we need to do a lumbar puncture. You must take a consent from the mother. She will ask you what's lumbar puncture, why we are doing this, what's meningitis, what's encephalitis, what's the side effects could be happen from this lumbar puncture. The third scenario may be a critical incidence, like if you do a mistake, like we give a child a wrong drug by mistake, and the mother know how you will manage or how you will deal and communicate with this angry mother. Also, it may be ethics. I don't know if you know. Does anyone of you know what is jovistic or jovistic? Does anyone know this, doctors? What's jovistic or jovistic? Doctors? Okay. Jovistic, it's like peoples, they refuse to take any blood. According to their religious concept, they should not take any blood. So, as in Essex, you will discuss, like we should have refused to do any blood test or to take any blood. Education, and this you will talk to a colleague or a doctor or a student, medical student. He will ask you about certain disease, how to deal with a certain situation. That is the scenarios that maybe come to you during the communication station. As I said, it's a 9 minutes station, and all of them it is with the role player. There is no examiner. Okay, what you should do in the communication? What is the examiner will give you the mark according how he will evaluate you. He will evaluate you according to your communication style, how you communicate with the patient. You have a good manner, you show empathy. When the mother is afraid from something, yeah, I really appreciate this. Sorry to hear this. If you use jargons or any medical term, and also about the knowledge that you give right information to the mother about what is the cause for the disease, what investigation we should do, what is the management we are going to do to the child. Okay. That is the marks criteria for the communication. Clear pass if you fulfill all the criteria what I have said. Pass if you were not fully fluent. You give the most essential information about the disease. You say the most essential information about the management. The bear fail if you have a poor communication with the role player, no eye contact. You say you miss relevant information about the management of the disease. Clear fail, you do like you ask, you should not ask in the communication. You ask questions, you interpret the mothers a lot. You don't make her to talk and to express her feels. The unacceptable, like you do any impolite thing with the role player. Okay, now we will go for the development station. Doctors, up till now, is there is any questions? Am I clear up till now?
Yes, doctor.
Okay. Development station, and really it is the easiest station in the DCH. Why? Because you should take a full mark of this station, 12 over 12 in part A and part B. What's the development station? You will ask it to assess the developmental domain for the child, the gross motor, fine motor, speech and language, and social. And it's 9 minutes station. All of them, it was the examiner. There is no role player. And I want to say an important difference between the development station in the DCH and in the MRCPCH. In the MRCPCH, the development station, there is a part for history. You will ask some questions about history. In DCH, there is no asking about history. The another thing, in the MRCPCH, you should imitate there is a child in front of you. Like, I will play with him. What a nice child. What a nice shirt. I will give him a cubes and I will try to play with him and I will build a tower of 5 cubes and I will see that he can do this or not. That is for MRCPCH. In DCH, no. It's just direct and clear. You will ask the examiner and he will answer you. I will give him a cubes. How many cubes he can build a tower? He will tell you he can build a tower from 5 cubes or 7 cubes. Can he walk? Yes. Can he go upstairs? Yes. 1 feet or 2 feet. It's just a question and answer. There is no an imitation that there is a child in front of you and what you are going to do. It's just clear. You will ask the examiner and he will ask you. The 9 minutes station for the development it's divided into 6 minutes and 3 minutes. 6 minutes, you will ask the examiner, as I said, can he walk? Can he build a tower? Can he know his name? Can he know the address? And he will tell you. And the last 3 minutes, he will ask you how you will manage this case. And if there is any delay in any developmental delay, he will ask you what is the cause for this developmental delay? What's your differential diagnosis? How you can manage this case. Okay. Now the clinical examination station. It's also a 9 minute station, also with examiner. Yes, it's a clinical examination, but there is no patient or role player. As in development, you will ask the examiner and he will answer you. The clinical station also, you will ask the examiner and he will answer you. But there is a little different here. As it's a clinical examination station and also it is an online, you want to evaluate your clinical examination technique. You should verbalize what you are going to do. Like, I will check his hand. I will look for if there is any clubbing, if there is any stria. I will check the pulse for the character. if there is any uh, any scars, like I will palpate the abdomen, I will go to check if there is any organomegaly. You verbalize what you are going to do and what you are looking for. And he can ask you at any time, like, how can you will palpate liver? How can you will palpate spleen? It's not a rule that he will not ask you about each technique for each maneuver. No, but he can ask you. Okay? The systems which you should know for the clinical examination station: the cardiovascular, the chest, the central nervous system, the abdomen, general examination, neonatal examination, and there is others like thyroid, local examination as in hemangioma. But the main stations, it's the cardiovascular, the chest, the neurology, the abdominal and general examination. Neonatal examination and the others, yeah, it's come, but it's not common like the above six stations or five stations. Okay. This 9 minutes is divided into 6 minutes and 3 minutes. The 6 minutes it for the clinical examination, how you will do this, like what it's come like what you will talk to Mrs. Joanne, the mother of Adam. He is 7 years old. He is coughing all the night. Please examine his chest. You have a 6 minutes to do the clinical examination by asking the examiner what you are going to do, and he will answer you. And after this, the last 3 minutes, he will ask you about your finding. What's your diagnosis? What's your differential diagnosis? How you will manage this case? What investigation you should do? Okay? I guess you should know that all the questions in every station, it's about these three. What's your diagnosis? How you will manage this case? What investigation you should do? Okay? Data interpretation. What's the data interpretation? You will have any test like a blood test, urine analysis, X-ray. Okay? You will have any test like blood test, full blood count, ABG, kidney function test, liver function test, and yes, there is X-ray, but I won't tell you that they bring very simple and easy X-ray. Maybe audiometry, gross charts, big flow meter, and all of them it's easy. It's not complicated or sophisticated. But the most common is the blood test, the urine analysis. Okay. And after you give this investigation, he will ask you to interpret the data. What's the meaning of interpret the data? What is the positive findings you find here in this investigation? What is the most important negative findings that you should say to exclude a disease? After this, he will ask you about what's your diagnosis according to investigation in front of you. What is the diagnosis of this case? How you will manage this case? Do you want any test to order rather than this? That is the data interpretation. And all of them, it's with the examiner. There is no role player or patient in this station. Examples for the data interpretation, maybe they bring to you hemolytic uremic syndrome, ITP, nephrotic syndrome, UTI. Okay. And that is the marks criteria for data interpretation. Clear pass, if you could really identify the problem and accurately interpret the data, you are fluent and confident, you know the guidelines according to the management. Pass, if you can identify the data but you don't say the diagnosis, you suggest a relevant differential diagnosis. In discussion, you understand the general guidelines or the general headlines for the management, but you lack the discussing in details of the management. Fail, لا قدر الله, if you don't have any diagnosis or any differential diagnosis, you have a limited knowledge about the management. Clear fail, you fails to identify the problem, so you give incorrect diagnosis or inappropriate differential diagnosis. You have a poor knowledge about management. I want to tell you something. I'm giving these marks criteria for each station to make you feel safe that not only by doing simple mistakes you can fail. No. If you saw for the pair fail, you don't give a clinical diagnosis. You said a limited differential diagnosis. So you will fail. Other than this, you will pass. So this marks criteria to make you to assure you that it's unassemble. As I know from a lot of candidates, they also have a fear or worry about, oh my god, I do one, two, three mistakes, I will fail. No, there is a criteria for fail. And even the fail, they they categorize them to pair fail and clear fail. But inshallah, no one will fail. Okay. Am I clear, Doctor, up till now?
Yes, doctor.
Okay. Safe prescription, and it is the last station in the DSH. It's like you will have also a scenario like you will talk the mother who a child have a bronchial asthma and he have a knee pain as he fall like during his playing, and a medicine have been like ibuprofen have been written to him. Find the mistakes in this safe prescription if there is any mistake. Okay, how you will correct these mistakes? There is something called PNF, which is British National Formula Guidance. They will give you a page which is called extract from the PNF. It's have the dose for the medicine, the indication for the medicine, what is the side effects of the medicine, what is the caution of the medicine. All of this, you should do it in 6 minutes. 3 minutes before the station, which is the preparation time, and the first 3 times of the station. And this 6 minutes, I want to say, it's really more than enough to find if there is any mistake, to know the side effects, the caution, if there is any wrong dose, and also what is the mistakes. Like if there is wrong name, the name of the child, it's written wrong. There is no date written. The address is written wrong. The dose is wrong. Okay. Also, you can use the PNF app on your mobile, but really, my advice: go for the guidance or for the extract. For two reasons: they give you really what they are going to ask. So if you just read the extract, there is no questions will be outside of this. The another important thing, they highlight by a marker under some important information that will ask you. So don't lose this advantage to know that there is a highlight for a question he will ask you, which is not found in the PNF app. Okay, let's go for this example. That child, he have a bronchial asthma. His name is Ross Admery. His address is 5 Highway, London, and that is the postal code. He is 10 years old, he asthmatic and fall down during playing and have a knee pain. The painkiller was written, and that is the prescription. Can you find any mistakes here, doctors? Can you find any mistakes here? Doctors? Hello?
مع حضرتك دكتور، بس أنا مش عارفة أطلّع حاجة بصراحة.
Okay.
مثلًا
The name. What is the name?
ماستر روز
Admiral?
فالنتاين.
Yes, the name is wrong. R-
إمم.
Okay, the address. The address is also long. The address is 5 Highway, London, and here's written 5 Evolves RD.
أها.
Another important thing, can you prescribe ibuprofen for asthmatic child?
لأ طبعًا.
Exactly. So that's an example for the safe prescription. So in this case, you will change this drug to paracetamol. Okay?
أوكي.
Okay, that is the safe prescription marks criteria. If you find all the mistakes and you have check all the side effects and the cautions and say it correctly, you will have a clear pass. Pass if you just say the essential criteria, like you find the mistakes, you know the most important side effects and the caution. Okay. The beer fail, if you miss any mistakes, you didn't get all the mistakes in the prescription, you have a limited knowledge about the side effect and the cautions you should take for the medicine, that is the beer fail. Okay. Okay, what is the source of studying for the DCH clinical? The clinical cases in pediatrics DCH clinical examination, which is called the Blue Book, it is the most important source for studying. The illustrated textbook of pediatrics and the bedside UK guidelines is very, very, very important. The guidelines, as all the examiners, you want to hear the management according to the guidelines. Okay. Okay. Is there any questions, doctor?
تمام جدًا يا دكتور.
Okay. Inshallah, we will begin our DCH clinical preparation course at the end of the December. The course is systemized. We cover all the branches, the cardio, respiratory, abdomen, every branch. Also, we don't give only the clinical or practical part. We give the theoretical part for each topic before we go to practice. So you know why you are asking these questions, what's the differential diagnosis, why I will ask this. The theoretical part is very important before to go the practice. Also, there is a written studying notes available, and I really recommend like to print these studying notes and to write any additional information in these notes. Like it's very important to pass in any test or any exam to have only one source of studying, to collect all information and to put it in one source. It's very important. We do practice after each topic and branch to reach to perfection, inshallah, bi'znillah. We have a scheme for each station, like scheme for the history, scheme for the communication, scheme for the clinical examination. The course, it will be 3 sessions per week. And for any details about the course, you can contact me on my WhatsApp number. You can take screenshots for this WhatsApp number. Is there any questions, doctor?
معلش يا دكتور، هو لو أنا معايا ماجستير، أنا
تمام
already أصلًا أخصائي فعلًا،
تمام.
تمام؟ لو أنا ذاكرت الدبلومة وكده، يعني هي هتضيف لي إيه؟ غير يعني هتضيف لي القيمة العلمية، صح؟ القيمة العلمية،
هتضيف
يعني أنظم مخي أكتر،
هتضيف لك
أفكر أحسن.
هتضيف لك كذا حاجة. هتضيف لك أول حاجة
آه،
إن أنتِ بيبقى معاكِ اللي هو إيه، دبلومة بريطانية، معاكِ شهادة تكتبيها مثلًا على يد أنا معايا دبلومة بريطانية، دي حاجة. الحاجة التانية الصراحة، الدبلومة البريطانية فعلًا بتفرق معاكِ جدًا in the clinical practice. It will systemize your brain, how you can manage this child, how can you know the differential diagnosis as it's a practical. Here in Egypt or any Arabic country, the master, it's more for the theoretical parts. But here it's like there is a patient with a certain history, with certain findings, how you will manage this case. أتمنى تكون إجابتي وافية ليك يا دكتورة راديكال.
تمام يا دكتور. آخر سؤال بس يا دكتور،
اتفضلي.
هو بس لو أنا هابدأ بيها وهاكمل الزمالة، هيكون إيه اللي ناقصني في الزمالة بقى؟
هيكون ناقصك التاس والاي كي بي والام ار سي بي اتش كلينيكال.
تمام، تمام.
تمام. هو كده كده الدي سي اتش فوب ودي سي اتش كلينيكال. الفوب ده موجود كده كده في الام ار سي بي سي اتش، هيبقى ناقصك التاس والاي كي بي ده الجزء النظري، والام ار سي بي سي اتش كلينيكال. المشكله ان في الام ار سي بي سي اتش كلينيكال في ويتنج ليست كبيره جدا، ناس بتقعد بالسنه وبالسنتين عقبال ما تلاقي سيت في الام ار سي اتش كلينيكال. في كانديديتس كتير اصلا بيخشوا للدي سي اتش عشان ياخدوا سيرتيفيكت بدل ما يضيعوا اللي هم ايه الوقت ده. هم اصلا كانوا بيفكروا في وقت من الاوقات ان لو خدت اي كي بي وخدت تاس and FOB to have like a diploma or and a certificate, as there is a long waiting list for the MRCPCH clinic. But the Royal College refused this. It was like a suggestion but have been refused.
تمام جدًا يا دكتور.
Okay, the most important message I want to talk you with you. بسم الله الرحمن الرحيم. إن لا نضيع أجر من أحسن عملا. If you want to pass any challenge or test in your life, you don't need to do what's essential to pass. No, you should do your best, and Allah will never waste your effort. إن الله هو الكريم. If you just take this message, it's more than enough. Okay, we have finished our lecture. If there's any questions, I'm happy to listen. Any questions, doctor?
تمام جدًا يا دكتور، شكرًا جدًا لحضرتك، شكرًا جدًا.
مع السلامة.